Hello, I'm Dr. Jung Kang, and I'm a resident physician in the Department of Radiation Oncology here at UCLA. Thank you so much for joining me today for my webinar on dealing with dry mouth in head and neck cancer patients. You can send in questions for me on Twitter using hashtag UCLAMDChat. Oftentimes in medicine, we focus so much on treating illnesses, preventing illnesses. We don't often give as much attention as we'd like to promoting health and wellness. Radiation therapy is often used to treat head and neck cancers, and we're able to cure a lot of life-threatening illnesses. But sometimes this comes at the price of side effects. One of the most common side effects that head and neck cancer patients talk about is dry mouth. And although dry mouth is not dangerous per se, it's absolutely something that can be slightly uncomfortable and can make routine everyday activities like eating a piece of steak a little more difficult than it used to be. But fortunately, dry mouth is something that we understand very well, and we can do a lot about it. So my hopes with today's talk are to provide you with some education about the role and normal functions of saliva, to offer you tips on how you can improve dry mouth symptoms, and to give you some advice on how we can prevent the complications of dry mouth. Ultimately, I hope that if we can give you some information, you can be an educated and an empowered you, and that will ultimately make you a happier and healthier you, and a more comfortable you, as you're waiting to give yourself the necessary time you need to heal. Head and neck cancer is an umbrella term, and it really actually is talking about cancers that are located in various areas of the head and neck. It includes sites including the nose, nasal cavity, and the back of the nose, the nasopharynx. It also includes the throat, the oropharynx, the hypopharynx, the voice box, the larynx, the salivary glands, and the paranasal sinuses, the area that you feel congested when you have a head cold. Head and neck cancer accounts for about 3 to 5% of all cancers in the United States. Slightly more common in women than in men, and slightly more common in people over the age of 50 than under. About 55,000 people last year were diagnosed with head and neck cancer. Radiation therapy is used to treat head and neck cancer, and it's a balancing act between maximizing the good, which is trying to control the tumor, and minimizing the harm, preventing side effects in normal organs that we want to try to protect. Ultimately, everything really depends on where the tumor originated and what the high-risk areas for tumor spread are. But to the best of our ability, using treatment planning, physics, and the most technologically advanced treatment machines, we're able to try to shape our dose and give enough to control the tumor and to prevent side effects whenever possible. One of the technologies that we oftentimes employ to accomplish these ends is intensity modulated radiation therapy, or IMRT. But even with IMRT, the oral care study group has shown that the vast majority, 90% of patients who've had head and neck radiation actually have some amount of dry mouth in the first year after treatment. However, if you look at these numbers, about a year later, a fourth of people have healed and no longer complain of dry mouth. And really, what this is saying is that with time, healing happens. However, there's a lot we can learn from these healers to see what they did to make themselves more comfortable along the way and what they did to maybe make it happen better and faster. It all begins with you. This is an experiment from a very famous cognitive scientist named Roger Shepard, and he really understood that as far as the human brain is concerned, oftentimes what you see is what your brain thinks you're getting. And if I were going to ask my audience to describe these two tables, I think you might say that one is a rectangle and one is a square. One is long and one is wide. Perhaps some of you might notice that one has 4 legs and the other has 3. That's what you see and that's what you think you're getting. However, upon closer inspection, what you can see is actually that the two tables are identical. And the only difference is that they're set at slightly different angles, and your perspective can entirely change what you're seeing. In other words, what you see isn't always what you get at all, and what you see is what you think you get. I hope that with a little extra information and more perspective, I can alter our understanding of the way we see things and empower you. And one of the founding figures of radiation oncology was Marie Curie, who taught us that nothing in life is to be feared, just understood. And I truly believe that knowledge is power, and I hope if I can give you some more information, you can exercise your power. Xerostomia literally means dry mouth, and there are a lot of causes of dry mouth. Some of them are actually medical conditions like diabetes, thyroid disorder, Parkinson's disease, Sjogren's disease, which is an autoimmune disease where antibodies are made against your own salivary glands. It can be from structural issues like a stone blocking the salivary ducts. It could be from chemotherapy or radiation therapy. Common sense things like dehydration, fight or flight stress response, smoking cigarettes, drinking alcohol. But actually, the absolute #1 cause of dry mouth, xerostomia, is medications. Xerostomia is something that affects a lot of people, including people who have never had radiation. In fact, about 10% of all people have some amount of xerostomia. It's a little more common in women than in men, and it's most common in the elderly and people who are taking any kind of medication, either prescription or non-prescription. Studies have shown that about 30% of people over the age of 65 have xerostomia. There are a lot of functions of saliva. The ones that are more commonly known: lubrication. Saliva helps us chew food, taste food, swallow food. It has proteins and minerals that protect our teeth and gums against gum disease and tooth decay. It has digestive enzymes so that when you eat a piece of bread or some ice cream, you can begin the digestion process in your mouth even before the food has made it all the way down to your stomach. It contains enzymes and antibodies that help keep the balance of microorganisms in your mouth appropriate. It has ions to help with pH acidity balance, and it has hormones that can help in taste development. And in a common sense way, it helps secure dentures in place. Spiders actually have glands in their belly that make something very similar to saliva, and they use it to trap food, which is not all that different from the way saliva helps us trap our food too. There are two major types of saliva: thin serous saliva and thick mucus saliva. Most of the saliva is made from your 3 major salivary glands, which you have on both the right and left sides of your face. The parotid gland is a large gland right at the back of your cheek in front of your ear. The submandibular gland is right underneath your jaw, and the sublingual gland is right underneath your tongue. Most of the serous, thin, watery saliva is made by the submandibular and the parotid glands. And thin serous saliva production is actually stimulated by the parasympathetic nervous system, which is your rest and digest relaxation nerves. In contrast, thick mucus saliva is stimulated by your sympathetic fight or flight nervous system, really because it's very important that when you're eating things, you want to be able to get the thick mucus saliva mixed in with the food so you can swallow safely. The components of saliva are mostly water. In fact, 99.5% of saliva is water, and only 0.5% is other stuff. Those other things are actually important. It's got electrolytes, specifically sodium and calcium and bicarbonate are very important, as well as mucus, the enzymes to help out with digestion, and the antibacterial compounds, proteins, and actually a lot of cells. At any given time, you have millions of human cells and billions of bacterial cells in your mouth. How do we make saliva? Well, saliva has a lot of stimulants. One is when you chew on food or when you suck on food, that will make you make saliva. Another is when you smell food. Oftentimes I tell people to take a stick of gum and to chew on it with their nose plugged. Many people will say their sensation of what flavor the gum is compromised or impaired when they can't smell. Then if you take a smell of your gum and then you chew it, oftentimes flavor is enhanced. Another way that we stimulate saliva production is actually even just the very thought of food. And Ivan Pavlov, a Russian psychologist, did some very important studies where he trained dogs to associate food with bells. Every time he gave the dog a piece of steak, he would also ring a bell. So much so that by a certain point in the future, dogs were conditioned to hear a bell and start salivating because they thought they were going to get some steak. Most of your saliva is made by your submandibular gland, the one underneath the jaw that makes both the thick mucus saliva and the thin, watery serous saliva. The parotid gland in front of the ear, at the back of the cheek, makes mostly the watery kind, and there are hundreds of minor salivary glands all over the mouth that make a little bit of everything. The average person makes 1 to 3 pints of saliva a day, which is actually a very big range of what might be considered normal. Most of your saliva is made in the afternoon, and the least is made at night, but production of saliva actually requires very good circulation, so it's important to do neck exercises to promote blood flow to the salivary glands, and also to stop smoking because that cuts off circulation. Medications are by far the most common cause of dry mouth, and even with head and neck cancer patients who've had radiation, many of them are also on medications that they need for other conditions. So this can even add to the dry mouth problem. Some people say that 63%, nearly 2/3 of the 200 most commonly used medications in America today actually cause dry mouth. Common groups of medications are antihistamines like Benadryl, anxiety medications, antidepressants, blood pressure medications, water pills, and some pain medications as well. So it's really important to talk to your doctor and your dentist about what medications you do and don't need if dry mouth is a very big problem. Ultimately, knowing that with time you will heal and make more saliva, in the acute setting, oftentimes we tell people to fake it till you make it. Use water, drink lots of water. It's 99% of what your saliva is anyway, so most people, I recommend that they carry a bottle of water with them. You could chew on sugar-free gum or candy because chewing on things stimulates salivary production. There are artificial saliva sprays or liquids. There are saliva-stimulating medications that we can prescribe. Some people like to sleep with the humidifier, but also just time. You need time to heal. There are a lot of things that you can do to prevent the complications of dry mouth. The common thing would be actually just drinking a lot of water because physically it can clear out the bacteria and other things that could land in between your teeth and in your gums to cause infection or gum disease. The other thing is hygiene. It's very important to clean your mouth after you eat and to frequently see your dentist for routine clinical checks and tooth cleanings. It's really important to protect your teeth with fluoride. And I can't emphasize this enough because fluoride trays can do something for you that water can't, which is really protect the tooth enamel and gums. Oftentimes, if you let gum disease get bad or if you let the tooth enamel decay, not only does it look unpleasant, but it feels very uncomfortable too. So really prevention is the best medicine. And also to eat. All of the enzymes that you have in your mouth to start digestion, you can get from other places. So if you continue to eat, you will digest your food. There are other parts of the body that can take care of it. Mind over matter, the oral care study group, showed that there are 2 ways that you could divide saliva. You can talk about unstimulated saliva and stimulated saliva. Unstimulated saliva is the kind of saliva that you have at baseline at rest when you're doing absolutely nothing. And that saliva tends to be a small component of saliva. Not much is being made. But the powerful thing is actually the stimulated saliva, which you are in complete control over by thinking about food, chewing food, or smelling food. You can make a lot of saliva. In fact, you can more than triple the amount of saliva you make just by taking those interventions. It would be very difficult to have a talk about saliva without also talking about taste because the 2 actually go hand in hand. Dysgeusia is the medical term which basically means an altered sense of taste. We used to think that the tongue is generally divided into compartments that are responsible for tasting different flavors. Generally speaking, sweet and salty was thought to be at the front and bitter was thought to be at the back. Oftentimes during radiation therapy, people feel that it's sweet sensation that's the first to go away and the latest to come back, because it's really not as important as bitter sensation. It's extremely important as human beings for our survival that we recognize when we're eating something that's bitter, because that could be poison. But that was sort of a gross oversimplification of the way taste works, and actually it's far more complicated than that. The mechanics of taste are actually pretty complicated. The tongue has about 10,000 taste buds, and each taste bud has 50 to 150 taste receptors per cell. That's hundreds of thousands and millions of opportunities for your tongue to detect taste. Also, these taste receptors regenerate every 10 days or so. The speed at which they regenerate is a little slower as you age, but taste buds are located all over the place, and not just on the tongue. They're actually located on the roof of the mouth, in the esophagus, as well as the back of the throat. I have a patient whose surgery for his head and neck cancer actually required removal of the entire tongue. However, he is still able to tell the difference between chocolate and strawberry ice cream, and he'll tell you which one he likes better. So there's lots of opportunities to taste everywhere in the mouth, not just in the tongue. And of course, I would have to talk about the fact that even though these taste receptors in the various parts of the mouth and the tongue are there, ultimately it requires nerves to carry this information to the brain. So there's a big brain mental component of recognizing and enjoying taste. Flavor sensation is actually now really thought to be a little bit more complex than the way it was before. And sweet, salty, sour, and bitter are actually thought to probably overlap in most of the parts of the tongue. Sometimes taste can be a little bit confused because sweetness, for example, is something that's not just detected by the presence of sugar, but sometimes proteins and other types of substances can do it, which is why non-sugar flavorings like the ones used in diet sodas and other chemicals they use to sweeten things can make you think you're tasting sweet, even if it's not actually any sugar. The way that we can improve taste is really essentially just to keep trying. Taste is the effect of a cause, which is food. Or the other way around, when you eat food, that's going to cause an effect, which is tasting things. So it's really important to try to eat a variety of foods. Oftentimes people like to start slow and steady with things like yogurt, soups, or oatmeals, milkshakes. All of these things are great, and I oftentimes encourage people to diversify, and even if they're used to something working in the first month, to start adding details like perhaps some honey to your yogurt or some jam to your oatmeal. All sorts of little things like this can get things to become alive and vibrant again. Ultimately, with practice and giving your tongue and your brain new things to have to re-recognize and relearn, you can basically train your brain to learn how to taste again. And ultimately, swallowing and taste and dry mouth, all of these things require a whole lot of work. In a sense, it's requiring daily and frequent exercise. The way that swallowing works, oftentimes people, because they have dry mouth, are afraid to eat challenging pieces of food because they're afraid that perhaps if they don't have enough saliva, the food won't go down smoothly. But what I tell people is to safely and cautiously actually push yourself and to treat it like going to the gym and having a workout and doing stretches and weights, because most of the things involved in swallowing properly are actually muscles. So when you take a bite of food and you chew it in your mouth with your teeth, you have to make a decision, I'm going to swallow this piece of food. From the back of your tongue, you're going to push the food backwards into the throat. And you want food to go down the food pipe, the esophagus, and not the windpipe, the trachea. And the way this is done is actually that first triggered action of the tongue pushing food back causes lots of things to happen in the neck. The uvula flops up so that food doesn't go backwards up into the nose, and the epiglottis flops down to protect the windpipe so that the only path the food can go is down the esophagus. One other thing that happens is on the outside that you can use to validate and check that all that is happening is that the voice box, the larynx, moves up. So I'd ask everyone who's watching today to go ahead and put their fingers on their voice box. their Adam's apple, and to take a swallow. And you'll see actually that your voice box probably moved up and that everything inside that I said would happen is happening. And you swallowed some saliva down the esophagus. I know it's a challenge and it's a lot of work, but I actually have a patient who is a professional singer, and he had very dry mouth in the first few months after treatment. You know, singing was not only his livelihood, but also the livelihood of all the people that he worked with. And so he forced himself to go out there and give a concert, even before he physically and mentally felt 100% ready. And he didn't want to show his audience what he had gone through, and he wanted to put on the caliber of performance that he's always put on before. And he went ahead and he sang an 82-minute concert with not a drop of water, either in a cup on the side or in his mouth. And so it was pretty remarkable. And I think what he taught himself from this experience is that he can do more than he thought he was capable of. And what he went ahead and did was gave another 82-minute concert the very next week. So I know that it's very difficult, and sometimes the process can seem like such a challenge, but things are changing and things are getting better. And according to Sir Winston Churchill, if you're going through hell, just keep going. Hopefully with some of these pointers and the information that I've been able to provide you with today, I hope that it's offered you a little bit of perspective and retrained maybe the way you might see these things. And the mind is very flexible. We can learn. And so even if you see something that looks like a predator mercilessly going after his prey, oftentimes what you see is that it's all a matter of perspective. And sometimes it's all the same. But once you've seen that lesson once before, you can probably look for what the trick here was. Thank you so much for your attention. Just wanted to let you all know that April is Head and Neck Cancer Awareness Month. And if you have any questions, please feel free to send them over my way to on Twitter, hashtag UCLAMDChat. We have a couple questions already. Are there any basic remedies, like baking soda washes, that you give for all your patients with xerostomia? And are there any medications that I find have been consistently helpful? This is a wonderful question. I actually do. I tell people all the time to use about a tablespoon of baking soda into a cup of water for multiple reasons. Bicarbonate is actually one of the more important ions. That's in that 0.5% of what constitutes saliva, and that's basically what baking soda is. It's really important for maintaining the pH balance in the saliva and in the mouth, and it's also important for just keeping things clean and comfortable and moist. There are lots of products out there that many people use. Biotin products are great. They have a whole line of sprays, washes, gels, and all sorts of things. I find that I think most people have just tried various things, and different people prefer different things. Some people like the gels, some people like the liquids. So I think the best thing to do is probably just to try things out and see what works best for you. But one thing that I will tell people is that oftentimes people find sprays that have alcohol in them, and alcohol is actually very dehydrating. So when you're purchasing products over the counter at your drugstore or supermarket, just take a quick look at the ingredients, because if there's alcohol there, it may not serve the goal of hydrating you so well. Are there any foods that I recommend to help my dry mouth? That's also a great question. Any food that you like, I would recommend to help dry mouth. Really, I'd say that the more common complaint is that there are certain foods that make dry mouth worse. So a lot of people find that a dry piece of bread is difficult, but a piece of toast with some butter or jam is better. So I think that the main idea here is, as long as you're chewing on food, and if you can smell it and think about it and enjoy it, these are all things that, as far as salivary output is concerned, should make things get better. How can you manage dry mouth during treatment? This is a beautiful question. So dry mouth during treatment does not happen immediately. Oftentimes the radiation therapy for head and neck cancer can take on average about 6-7 weeks to complete the whole course, and the first 2 weeks really tends to be actually a very honeymoon period, I guess is the way I would say it, where there aren't very many symptoms at all. At first, it's really the thin, serous, watery saliva output that becomes decreased, and actually by the end, many people might say it's the thick mucus saliva that there's too much of. But with time, in the healing phase, in the few months that come after, the thick mucus saliva begins to decrease and some of the thin, serous, watery saliva starts to come back. So the main thing I would say in the setting of getting treatment that you can do to make dry mouth better would be actually to do the baking soda washes. That's actually one of my favorites. I tell people to do the baking soda in a cup of water, both throughout the day, 3-4 times a day in between meals, as well as sometimes in place of brushing your teeth. By week 7, sometimes people find it painful to brush their teeth, and so the baking soda wash really can serve a great purpose for getting that done. And there are also other things that we can give you during treatment, but I think that most of the things that you can buy, actually the main ingredient that makes it work so well is the baking soda. So sometimes a simple basic remedy like that can do the trick. What kinds of medication are there to help me with my dry mouth? There are drugs that can actually stimulate the parasympathetic or the rest and digest nervous system. Sometimes we give those out, but one of the things we have to look at a lot of the time is other medical conditions that you may have, and so I don't generally prescribe anything. I usually like to see what the specific issue is and see how we can work around it. But most of the medications that I give actually tend to be over the counter. Things like the biotin products, washes and gels, as well as sprays and ulcer ease and all sorts of rinses. And what are the complications of dry mouth? So the main complications with dry mouth are actually the tooth and gum complications. So it can make dental caries, gingivitis, periodontal disease, things that are painful and actually can cosmetically, not always look great. And so that's why we really emphasize the fluoride treatments, putting the fluoride gel into those mouth trays, because it can really do a lot of great preventative work. And is there anything I can do to prevent my dry mouth? That's a great question that we get a lot as well. As far as preventing dry mouth, first and foremost, a lot of it really is luck of the draw. Sometimes you have a tumor that's sitting quite far away from the salivary glands, and there are no lymph nodes near the salivary glands that need to be treated, in which case I would expect a patient to have no dry mouth at all. But sometimes with certain sorts of tonsil and base of tongue oropharynx tumors, or if there are lymph nodes in the neck involved, treatment actually requires some amount of scatter to go to the salivary glands. So I would say that the best thing you can do to prevent dry mouth is actually just to work hard to keep things clean and to eat foods and do your exercises, and let us try to do the best we can to make sure we do what we can to prevent this for you. Okay, I think that's it for questions. Thank you so much for joining me today, and this video will be available on demand on our website, radonc.ucla.edu. Thank you very much.